MRIs and surgery. I'm sure by now some of you are sitting there saying, but I do have an MRI that shows a complication. The problem is, when you go looking for something, you are more likely to find it. If you focus on something, you're more likely to notice it. When you constantly focus on your pain or MRI findings, you are more aware of insignificant movements and sensations. How many red cars or motorcycles have you seen today? You're now thinking about it, and over the next week, I bet that you will notice them more. If you take your car to a mechanic, they will likely find some things that could be fixed. If your oil light comes on, does that mean that your car will instantly stop working? No, it means that you should fill it up at some point soon. When it's snowing outside, does that mean that you can't go outside? No, it means that you don't go out in shorts and a t-shirt. You put on a jacket. In any industry, a professional knows their specialty best. This means that when you go to a surgeon, they usually want to perform surgery. Sometimes they might say that you do not qualify, which can be from an insurance standpoint or based on their professional opinion. Remember that you are the client and you are the one that makes the ultimate decision on when it is time for surgery. A good surgeon, doctor, or therapist will tell you all of your options and answer any questions you may have to the best of their ability. Many of my peers agree that you should never have surgery just because of an MRI. Try some form of rest and therapy first, and then determine if the loss of function is enough to warrant going under the knife. Every time you go under anesthesia or have any form of surgery, you are increasing your risk of complications to your body. Even with successful operations, it is not uncommon to have an abnormal MRI finding afterwards. I'm not trying to scare anyone away from surgery. Sometimes I even educate clients that surgery is the best option for their particular case. What I want you to take away from this is that every situation is different and you need to weigh the pros and cons before doing anything that alters your body. My own doctor and colleague used to perform surgeries and said it best. We don't do surgery for pain. We do it to increase function. There is never a guarantee that pain will go down, but mechanically we can change the body. In a research study from 2021, 184 individuals with shoulder impingement pain lasting over 3 months were given surgery, placebo surgery, or exercise therapy. Follow-ups 2 and 5 years later found that most of the individuals from every group had gone back to work. There was no significant difference between having surgery or not. This is one of many studies that show surgery may not be necessary in all cases. Even if you have surgery, you need to know what to expect after surgery. For quality outcomes, you will need some form of therapy to increase strength, range of motion, and function. Working with a therapist, they can safely modify your program as needed. I cannot count the number of individuals I have worked with that thought they could have surgery, not do the therapy after, and be back to normal. This could not be further from the case. I have seen a high number of people with this mindset that end up even worse after surgery because they did not perform proper aftercare. Sometimes they even need to have another surgery to correct the functional loss that could have been prevented with therapy. Hopefully, you will participate in some form of physical or occupational therapy prior to surgery. Typically, physical therapy will address the mechanical structure of your injury, and occupational therapy will show you ways to modify your environment or daily tasks to increase independence. Even if you and your doctor already know that you will be having surgery, strengthening the area prior will decrease your recovery time because you will not have to work so hard to get back what you lost. Additionally, already knowing what to expect from therapy after surgery will mentally prepare you for what is to come. Sometimes doctors also send clients to therapy first to see if they will be compliant. If you do not do your therapy before surgery, the odds that you will do it when you are in more pain is highly unlikely. I had a client that had poor outcomes after knee surgery because she demonstrated fear avoidance behaviors, frequently did not attend therapy, and did not perform any of her home exercise programs. Another surgeon recommended shoulder surgery just because of an abnormality on her MRI. Her pain level was low and she had no loss of function. Honestly, there was no good reason for her to have surgery. Knowing the shoulder is even harder to rehabilitate, we tried educating her on how much harder and more important compliance with therapy would be. Despite our best efforts to recommend she waited until she had a greater loss of function, she had surgery and poor outcomes. Study after study, researchers find that hypersensitivity of the central nervous system is the cause of ongoing symptoms and not local tissue damage. Translation: your nerves are sensitive and there is nothing wrong with your muscles. Through the aging process, it is also common to see an increase in various abnormalities such as arthritis, tears, and bulges, but this does not mean that the pain will increase. My doctor loves to ask patients, "How old are you?" and "How old is your knee?" Just like cars have issues as they age, so do we. But that doesn't mean that they will stop running at a specific period of time. Now I want you to take a look at these charts. One is related to the back and the other to shoulders. But there has been similar research on all areas of the body across age groups with similar results. The key thing I want to point out is these percentages are of asymptomatic individuals. An asymptomatic individual clinically has an abnormality, such as disc degeneration, but they do not feel any pain. As you can see, by the time you are 80, you will likely have an abnormality. But if you take a look at the 20-year-olds, you will also see that they still have some issues. Regardless of age, these individuals are still able to go on with their daily activities. Want some more statistics? There are plenty, but I'll hit on a few from each area. Remember, asymptomatic means that these individuals do not experience pain, numbness, or tingling, and nothing out of the ordinary impacts their daily life. MRIs were commonly used to locate reported abnormalities in the studies. For the spine, only 10% of individuals with significant degeneration experience pain. Most professional demolition derby drivers will crash over 1,500 times and do not report chronic whiplash associated neck pain. Disc bulges start reabsorbing in weeks. For disc herniation, 83% of individuals had a complete and sustained recovery. With the shoulder, 1 year post successful rotator cuff surgery, over 90% of asymptomatic individuals have abnormal findings and 20% have a complete rotator cuff tear, with reports of excellent pain reduction and increased daily living. For the hip, 73% of asymptomatic individuals have abnormalities of the hips and 69% have labral tears. And the knee, 25 to 50% of asymptomatic individuals have significant degenerative changes. 30% of knee replacements are considered unnecessary. I'm not saying that all MRIs are useless or that they determine if you need surgery or not. They are a great tool to get an idea of what may be wrong, but no more than that. How many times have you taken your car to the shop or your pet to the vet for an issue and the professional said that they weren't entirely sure what the root cause was? It might take them several tries, or they may never be able to correct the issue. I had two MRIs a year apart read by several independent and very qualified professionals that noted an 80% rotator cuff tear that remained unchanged. In fact, all four rotator cuff muscles had tears. There was no specific event that caused the tears, and I was even told that I likely had issues for many years before my daily activities began to decline. Keeping the area strong and flexible for years kept me from having surgery until I was in my 30s. When the surgeon went in a month after the last MRI, he found the area to be intact and in good condition. What started as potentially multiple areas needing to be put back together ended up being a general debridement or cleanup and a minor modification of bone structure. With my own therapy, about 80% of normal range of motion and function was achieved in just 8 weeks. That doesn't mean I stopped there. I had to continue working on my own strength and range of motion exercises for a year to prevent a reduction in gains. I would have needed an even longer time period if I hadn't started strengthening the area a year before surgery. Let's talk for a moment about terminology. Abnormalities: bulging, collapsing, crumbling, degeneration, disc disease, high intensity zone impingement, instability, partial or full thickness tears, ruptured, traumatic injuries, or wear and tear. Do these words give you happy feelings? No. Simply hearing a doctor say one of these words can cause your pain and fear levels to increase. Just the knowledge of having one of these issues can cause pain that you didn't previously experience. To make matters worse, the medical professionals understand what these terms mean and usually believe that they are factual. They turn around and tell you either, it's just a bulging disc, minimizing the situation, or it's a bulging disc, magnifying the situation. As a professional, I know that a bulging disc is an area of the spine that is outside of where it normally is. This may cause no symptoms or minor symptoms that can resolve in a matter of days or weeks. As a common individual, you might feel that you are broken, and an online search of the condition can make you feel worse. In one study, a random group of people were asked to undergo an MRI of their low back. Almost half of participants who reported lower back pain had normal MRI results. Over a third of participants who reported no pain had abnormal MRI results. Over the next 12 months, some of the participants who previously had no pain and abnormal MRI results started to experience back pain. Another MRI was performed with no changes to account for the new pain sensations. So, what happened? Just the knowledge that something was abnormal increased pain without any changes. Summary: when you focus on something, you are likely to be more aware of it. If you are looking for something, you will likely find it. A professional knows their trade best, but it doesn't always mean that it is the best course of action for you at that time. There are a number of risks when you go under anesthesia or have surgery, so it is important to weigh the pros and cons of each. There is also no guarantee that surgery will correct your problem, and it can even make things worse. After surgery, you will need to perform some form of therapy. If you are planning on surgery, talk to your doctor about therapy beforehand to reduce your recovery time. Body abnormalities are common as we age, but it does not mean that we will experience pain when they occur. X-rays, MRIs, etc. are great tools, but it doesn't mean that something needs to be fixed. Even the terminology or information that you get with your results can increase your fear and pain responses. If you are considering surgery, talk to a variety of professionals that will give you an honest opinion about your condition. The most important thing to remember is that it is your body and you are the one that makes the ultimate decision if you will have surgery or conservative treatment.